My goal was to implement an individualized lung protective strategy in our ICU. Older days, we had only statistical approaches to treat our ventilated patients. That means there was obviously the risk for the individual patient of a harmful treatment, for example with a ventilator-induced lung injury.
We know that every invasive mechanical ventilation therapy is potentially harmful for the patients. The FRC measurement, and especially in combination with the transpulmonary pressure measurement, is for us one of the most important features. We need to find an optimal lung protection therapy for the patients, and especially we found out that this leads us to a very individual therapy, because we realize that the measurements are individually very different.
In today's practice, we routinely measure the FRC in all invasive ventilated patients. In specific patients, we also used the transpulmonary pressure. This allows us to individualize the strategy of a lung protected ventilation. We used the FRC measurement to titrate the PEEP to the optimum in the concept and stress and strain.
For us, it's the most important thing to be as less harmful as possible. This past, present, future feature was for us something new, but after a very short while we really liked that, because it is very important to go back in the past and to find certain events and also to calculate those events and take them into account for the further decisions in the therapy. And especially with the CARESCAPE R860, you have a very nice overview about those events.
Well, I remember first demonstration, it was this past, present, future possibility. I thought, wow, that's it. It's easy, it's logical. Must be like this. Well, for my staff members, I think they got very fast close to this ventilator, because the possibility of the touch screen, they know it from their own smartphones or from their own tablets, so it was very easy for them to act with it. It's just this aspect that what's important, you see it on the first sight. You don't have to search for it, it's obvious. Just when you look at the CARESCAPE, you see what's important, and that's a benefit for the patient.
The CARESCAPE R860 is a very good ICU ventilator with a broad range of therapeutic options, and with a very nice user interface, which is very easy to use for everybody who has to work with it.
If you want to implement a lung protective strategy on your ICU, it's easy to do that. With the CARESCAPE R860, you have all the opportunities for a modern, individualized, personalized ventilator strategy for your patient.
It's a new generation of ventilator, and it supports our daily work in the ICU.